Hi,
There you
Gregorio.
are. There you are.
Now it works. Perfect.
It's funny because we are not far away. We are very close in Zurich, actually.
Ah, perfect, perfect. We are neighbors.
We could be together, exactly. Next time we do it together. I come to Dermanans and we do it
Perfect,
together.
perfect. You're always invited.
Good, good. So, Dr. Marianna, I was just already briefly introducing you, but now that you are here, as is the first time that we have you with Swissline, not with Swissline, the brand, but Swissline, these live chat adventures. Maybe just in 1-2 minutes, can you say some words about yourself?
Yeah, of course. I'm Dr. Meli and I'm a dermatologist. And I opened my own clinic in November 18, the Dermanals at the Bahnhofstrasse in Zurich. We offer the full spectrum of treatments to our patients, not just illnesses. Of course, aesthetic treatments are a big issue. And of course, we have for our patients as well the best skincare brands here in our small shop. And one of the best skincare brands is, of course, Swissline. That's why.
Sounds good.
Yeah.
Sounds good. So what are the most, before we go, because we will go one by one, a little list of those aesthetic medicine treatments, but what are the most popular? What is that keeps you busy most days? Is there something that you do almost every day?
Yeah. The most popular doctor treatments, we offer doctor treatments and treatments which are done by our cosmeticians. Most frequent is Botox and filler. This is has been since years, but they are really efficient treatments, and this is a daily business.
Okay, so we'll go to those, but I think I cannot resist from the menu I saw from Dermanans. One that really caught my attention and I'm very curious about because it's also kind more of a buzzword is these vampire facials.
Yeah.
So the PRP. So can you explain what it consists, what it's doing?
Yeah, the PRP or vampire lift is a treatment for hair growth and for skin rejuvenation. And this works with the patient's own blood. PRP is platelet-rich plasma. That means we take blood from the patient, we centrifugate it, and then we inject the growth factors, the platelet with the growth factors, the substances from the own body into the skin, and this makes is anti-inflammatory, makes activation of the tissue, and for the hair, of course, it works for hair loss, against hair loss, and it's a really demanded treatment also, of course, for men with this hereditary androgenetic hair loss.
The hair loss.
Yeah. It's not just for the face, for the anti-aging, but we have the demand is much more for the hair loss in men.
And you need a lot of time from the blood collection. So you collect the blood. How long do you need to wait to then re-inject it?
It's about 10 minutes, and you have to inject really the fresh plasma. You can't leave the plasma a long time.
Of course.
So you prepare everything, take the blood, centrifugate it, 5 minutes, and then you inject right away. The blood has to be really fresh. After half an hour, you can't use the blood anymore.
And this is like small injection, like point by point, right?
We have a so-called mesogun. It's a gun we use it as well for mesotherapy, and it's not so painful. Before, when we didn't have this gun, I did it with a syringe, and this was quite painful. But with the gun, it's like 5 tiny needles, and you almost don't feel the injection. But it's not a nice treatment, and you look afterwards, you look a bit,
So you better go home, right? You don't do it before a party. You go home.
No. You have like 2-3 days. You have that. Of course, on the scalp, you don't see anything because you have the hair. But in the face, I don't recommend it before a wedding or so. You have to, most common patients come on Friday, and on Monday, you don't see anything anymore.
Okay, because I think the name vampire, but then it's like it's a self-auto vampire, right? So it's your own blood.
Vampire is because you suck the blood and then you inject the own blood. This is, and afterwards you look a bit bloody, so
a bit swollen.
Well,
Would you say, because we promised to say what's best and what works when, this is more a preventive, dynamic, more than a very mature skin solution, right? So it's more for younger.
Definitely. It's for younger patients, for men and women, and who want to prevent that wrinkles get deep. It's for superficial wrinkles, it's for hydration, activation of the skin. If a patient comes with 60, 70, 80, has a deep wrinkles, need volume, you don't offer a vampire lift. So it's really,
so it's a revitalizing type of dynamic.
It's in the 30s, 40s, young patients. They want to have a natural, it looks always natural because it's no filling, it's no toxic substance. Some people are afraid of Botox. They think, oh, it's a toxin. Yeah, it's a toxin. It's natural. It's your own blood. You can't have any allergies, and
of course, yes,
and that's why it's a mild treatment. You can't expect any deep wrinkles to go. You have to know for which reason you're doing it. Yeah.
Okay, so I'm 50, soon 51, so it's
but you look so young. For you, it's great.
And I don't like the idea. I don't like the idea of that blood injection. So Botox, I'm curious. So I've not tried it yet.
Never.
No, never. Well, I do have. You see, look at this.
Yeah, but why do you look so young? Why do you look so young?
I'm the skincare guy. I'm not the procedures guy. I'm the skincare guy. In the end, maybe we can advise 1 or 2 skincare products. So let's talk Botox.
Yeah. So, Botox is mainly for wrinkles which are caused by the movement.
Exactly. With the expression, right? This frowning.
It's the frown lines, it's the front lines, it's the cross feet.
Yeah.
It's more a treatment for the upper face. And this kind of wrinkles are caused by the mimic muscles. And with the Botox, this toxin, you block the nerve which activates the muscle. The Botox is perfect treatment for this kind of lines, because with the skincare you can do a lot, but some people, they have really a strong movement, so they sit in front of the computer and always grind. They do this grumpy face, they have the headache, and then the Botox is great to just relax the muscle and then to have these lines done. So if you are older, then sometimes with the Botox itself, the lines don't disappear. So then we need an additional, for example, hyaluronic acid filler. But for younger patients, and you should start the Botox when you see that the wrinkles are still there when you're relaxed. If you see a little bit a wrinkle when you're relaxed, then you should start the Botox. If they are deep, if they are deep, then even with relaxing the skin, they remain the wrinkles, but less. Then you need additional treatments. So Botox is mainly for young patients with active muscles in the skin, in the face, and it's really a low risk treatment. So it's not a toxic.
In the right hands, right? If it's done with the right hands, the right person.
Of course. But it's really. It's a bit
now,
uncomfortable. It's also an injection. It lasts about 4 or 5 months. It's not so long. So usually patients come 2 or 3 times a year. And the good thing is, a lot of patients, they always tell me, also people with headache or migraine, they profit a lot because this tension from work disappears.
Look, Dr. Meli, just Noel Geronimo just saying best clinic in Zurich.
Oh, nice.
I don't know if you know, so if it's a patient of yours, next time.
No. He's also, as you, he has a skin brand. It's By Nacht. It's a new, it's also.
So it's a friend. It's a friend. Okay.
It's a friend, and we have his skincare line as well. It's a new brand, newer one. So it's not like Swissline. We have it for several years, and the By Nacht is really new. Yes.
Okay, Noel. You can stay there. So you said something that caught my attention, because you mentioned could also associate Botox to fillers, like to different. So that's maybe the ideal combination for more mature, more complicated situations, no?
Yeah. A lot of people, they don't know the difference really between filler and Botox.
Yeah.
You have to imagine that filler is a substance when you need more volume. You want to create something. So with the age, for example, the cheeks, the bone gets absorbed. You have this sagging of the skin, and you have, for example, the nasolabial fold. Here with the Botox, you can't do anything because it's not muscle related. You need volume.
The loss, right? It's a loss of adipocyte,
fat, a loss of the bone absorption, of course, and the fibers in the skin, they get less. And then we use the filler. Classic localization at the cheekbones. In younger patients, if you want to have a little bit more lip volume, is really demanded. And of course, we can also for the nose, if you have not a flat nose, or if you need a more chin, or the jawline. Men love to get this muscular jawline, for example. Here, Botox makes
nothing to do, right?
Nothing to do. It's not a muscle you have to block. For example, Botox is here if you have this teeth grinding, or if you want to have an oval shape. Then you do Botox in the masseter muscle to block that you don't grind the teeth. And Asians are doing this treatment a lot because they want to have from this square
more oval, right?
Yeah, more oval. But most in Switzerland, we most do fillers to have this more edgy face, or have more contouring. And in elderly people, you need much more volume. Young people,
of course, because you lost more density and more volume.
Yeah.
I was also told that some fillers, namely the hyaluronic acid, can also solve some very stubborn, like dark circles when it's not pigmentation, when it's like a halo, right?
Yeah. I do this once a year because I have it the same. If you have this hollowing of the under eyelids, so there are just two possibilities. One is hyaluronic acid filler, or you use fat grafting, because there you need a substance to fill it.
To fill,
If you have this hollowing, you look always tired, and you see this shadow. And with the filler, you can remove that. If you have pigmentation, a dark pigmentation, then no way. Then you need substances. Then you need skincare products,
of course,
to lighten the pigmentation. But if you have, some people have both. Then we just treat the teardrop that looks better, and then with a good skincare, you can brighten the skin.
This is very interesting because we have, of course, solutions in terms of ingredients. I mean, alpha-arbutin, a lot of caffeine, ceramides. I mean, there are many things for the eye contour, which in skincare can help. But when the problem is that deep halo that creates a shadow, right? There is no way around it. You can sleep hours and hours and hours. You wake up looking tired.
Yeah, and some patients, they have it in the 20s. So it's also hereditary thing. It's not always with age related. So I've really young patients who they have this hollowing, and they come for hyaluronic acid fillers.
And is it very painful? So you have a needle that goes from
this is compared to lips or other localizations, it's quite not at all painful, because you have I always work with the cannula, not the needle. And you do an injection point down here on the cheek, and then you go with the blunt cannula underneath of the tissue and deposit the hyaluronic acid. So you feel a bit the pressure, but you have just one little sting down here, and then the rest is And
it's not really like a needle in the eyes, like that's what most people would be scared.
Yeah, this is a quite dangerous area. You're not with the needle in this area. So we use the blunt sterile cannula and go underneath, and then we deposit. And it's other localizations, for example, the lip or the nose, are much more discomfort, because with the lips you have several injections. You have to really have the perfect structure and so on. Here's just one each side, and it's done. Yeah, it's a really good treatment.
And in terms of because then the body will reabsorb that hyaluronic acid. So normally once a year, twice a year.
Yeah, it depends of the region, because, for example, for the cheek or for the chin or for the nose, we need a strong filler. We need a filler which makes a contouring, and this filler lasts much longer than the not so strong filler for the teardrop. So in this area, to modulate, the filler lasts about 1 year, sometimes even 1.5. But for the tiny wrinkles, for the under eyelid teardrop, it's like 9 months till 1 year, like this. Because we have several products for each indication. We have the perfect filler. For example, if you use the filler of the teardrop over here, you have no volume, no structure, because here you need like a bone, you need a hard filler and not a weak one. But if you have these tiny wrinkles, you can't use this hard filler because it will look weird. And then the molecule of the hyaluronic acid is much weaker, is much more it's much a thinner substance.
Yeah, more. That sounds very
faster.
That sounds very important, to have also the doctor who can advise the right molecular structure for the area, because sometimes we hear, of course, oh, that filler looks too much, and we think it's because of just the amount of the filler, but it can also be the wrong filler.
Of course. And some fillers, they last. So in filler, you have a good quality filler, and you have as well bad quality filler. So you can
like
buy
skincare, like skincare.
Yeah, it's the same. You can buy a filler from Asia for like $50, but it lasts about 2 months. So it's the quality of the filler is really important, because a high quality filler, they have a lot of studies behind. You have all the support. You have a long-lasting filler. Some young people, they think, oh, I go to a cosmetician for like 300 francs. I do my lips, but after 3 months, it's all absorbed. So then you prefer. I would prefer to pay 600, and you have it for 1 year or more. So for the filler, it's really important which brand and which product. For Botox, Botox is a medication. You can't have bad Botox, because Botox is from the Swiss medic is allowed as a medication. So you can't have cheap Botox.
Cheap Botox, exactly.
So
but fillers is much more complex.
Filler, and Botox, just doctors are allowed to inject Botox. With fillers, in fact, it's not regulated, so anybody can inject. And there, the anatomy, the knowledge of the anatomy is so important, because you could really have severe side effects, and you can have some people have a blindness or necrosis, like when you fill the filler in a vessel, it's really dangerous. And that's why you have to have in the clinic as well a medication to dissolve the filler.
Correct.
And this is not everybody who's doing filler has this, and this is really important to know.
Important.
Yeah.
And even it's very interesting, then we move to the next one, but it's very interesting that we in skincare, we are so obsessed with hyaluronic acid, and the possibility topical penetration of hyaluronic acid is limited. It's very limited, of course. I mean, nobody can claim with honesty that topical hyaluronic acid will go all the way to the dermis, of course. But that hyaluronic acid, if it's of a very biological quality that you inject, can also help to boost your collagen, your regeneration.
You have even an effect when the whole filler is absorbed. But the best way is always a combination. So I always recommend my patients to do daily skincare, to use sun protection every day, antioxidants, hyaluronic acid, vitamin A. So it's not, if you once a year come for Botox and filler, you won't have a
good-looking skin, of course.
The most important is what you do every day. And then by times a treatment to enhance this.
Correct.
So it's more, even the skincare is more important than the treatments we offer, because it's what you daily put on your skin.
It's your health. In the end, it's the skin health. I think it's a very old-fashioned idea that you do either or. There was a bit this old idea that the skincare people don't like the doctors don't like the skincare people, because they were kind of fighting for their ground. And that's quite old-fashioned, because of course the combination, it's
the best looking older people, they always combine. They do a good skincare, and they always work a bit on the skin. They once in a month they do a treatment, not too much that it looks done, but always a little bit, and this looks completely natural. But they always work on it, and they use daily products, and then with the age you see the difference. In a young age you don't see much difference, but the longer you use it, the more you see it, because you have less pigmentation spots, you have less sun damage, you have less vessels, and so on. And this we can treat, of course, this age signs, but it's much more difficult if you have it in a level where you can't really turn back the time.
Of course. So let's touch on pigmentation that you just mentioned. So I think we did enough of volume, wrinkles, the vampire. What about pigmentation? I think also we should differentiate a bit the age spots, the melasma. So
these are two complete different diagnoses. So the melasma is a hormone related pigmentation. We see this in young women. Also men can have melasma, but it's so rare because it's estrogen. The estrogen is the problem.
Responsive.
And the young women with a high level of estrogen, and if they take a contraceptive pill or during pregnancy, the melasma gets much worse. And usually it's the pigmentation on the front. It's like it's not so, the age spots are more one spot after another. The melasma is a flat pigmentation on the cheek, around the mouth, and gets worse with the sun, of course, pregnancy and contraceptive medication. And the melasma, the women who have melasma, they have always work on the skin, because it's not, we can't do a laser and the melasma is gone. It's not like the age spots. You have to have always ingredients in your skincare, bleaching ingredients. You can do some treatments, for example, a laser peeling or bleaching peels as well, but you need a daily care, because the melasma disappears after years. So when the estrogen level goes down, so these women, they suffer quite a lot and long time of this. So, and the age spot is completely different. The age spots, we call them like this, they come with the age, and they are more patchy, singular. Typically it's on the hands.
Yeah, more visible, isolated, and, right?
Yeah,
more
and this
spots.
has nothing to do with hormones, and this is a sun. It's a sun damage. And these spots are quite easy to treat with the laser. We just laser them away, or we give them bleaching creams, and then they come again by the years if the patient doesn't do a good sun protection, and they come again. And these patients, they come like every 2-3 years to remove these age spots. And this works really good with the laser.
And the laser means how many sessions? Like let's say for an average.
Yeah, for the age spots is 1 to 2 sessions and they're gone. So the laser is really potent. We have a Q-switched NDIAC laser, it's called. But you look afterwards, you look horrible. So it's not comfortable.
What did I tell you? That Dr. Meli is always very honest. What did I tell you?
Yeah, no, it's really like this. So you look like really these brownish spots, they turn like violet or red, dark, and after 2-3 weeks
even out. They even out.
Yeah. So it is, you have a downtime, you look horrible, and the hands even more, because they don't heal that fast as the face.
So you should do it like before vacation, but not summer vacation, like that.
We do it just in winter time, from October till April, when you're as white as possible. For every laser, for each laser, the best time, even for hair laser, for tattoo laser, for pigmentation vessels, you have to be as white as possible, to have less possible side effects, so that the laser can really focus on the pigmentation. And of course, some days maybe without any important event. So I always recommend it to do it much.
And then of course sunscreen, like religious.
Sunscreen. You can cover it, you can use makeup, but you look really, it looks growth, but in the end it looks perfect.
But that's adapting. So I think this was very interesting, because I think a lot of our followers, they for sure are confused with the melasma and the age spots, and we always hear laser, everything pigmentation laser, and you just said that for melasma, the skincare, it's much more important than
you have to do always something, and laser is an option, but it's not first line.
Yes, exactly.
So you do with the laser, you have to use low energy laser. You need 10 sessions, and next summer it can be the same. So I don't recommend it. I recommend the laser if the patient wants to have another effect of the laser. For example, we have this Hollywood or carbon peel. This is also a newer treatment where you put a carbon mask on the skin, which
it's like this black powder, like
black
powder.
black
Okay.
powder. And then with the Nd:YAG laser, we shoot this powder away. And this is a treatment as well against impurities. Is you have this nice smooth skin for the glow.
Resurface. It's a bit resurface, no?
Yeah, but really mild. So it's
Mild,
as well. It's called Hollywood peel because you can go out. You look like your skin looks fresh and
Hollywood peel. We learned something. Hollywood peel.
You have no downtime, so you can go out and you look great. And this helps as well for pigmentation, but not so strong, of course. And if a patient with melasma wants to do an improvement of the rest of the face, then I recommend it. But just for the melasma, I don't recommend laser.
Okay.
Yeah.
And this Hollywood peel, if you also do like glycolic, salicylic acid home, retinoids, is there like incompatibility or it's okay?
It's perfect. You can use whatever you like. Yeah, you can use whatever you like. Before the treatment, I always recommend to stop, for example, the vitamin A, stop like 2-3 days before, because the vitamin A makes really sensitive.
Yeah.
And the stronger the laser, for example, the strongest laser we do is the fractional CO2 laser, where you really shoot tiny holes into the skin. This is a treatment for scars, for deeper wrinkles, for young patients with acne scars. And there you should really stop before the aggressive ingredients, because your skin is much more sensitive to the laser. And then after healing, you can start again. But for every treatment, before and the care after is so important.
Yeah. We love, I mean, we love to hear that, because we, I mean, at Swissline, we developed this line, Age Intelligence. That's what we call it exactly, with the idea that it's very hand in hand with procedures.
Yeah.
I mean, we even have like this recovery serum, which has specific peptides to also help to extend the benefits of everything you are doing, and maybe address some of the side effects, some redness, some sensibility. But I think it's very good you say that, because in the skincare industry, sometimes people are overly scared with the idea that glycolic acid, retinoids, that they are themselves like very problematic. What is problematic?
No, I love it. This is the retinol is my favorite ingredient. So it's
mine too.
sun protection and the retinol, they are the most potent ingredients on the market, and we have studies for years, because it's used for acne patients, and we have a lot of experience. And you see with these products, a good sun protection, a retinol, you really see a difference in the face. So you see your skin changes if you use that. And the important is to know that the retinol, you can't use it during pregnancy and lactation.
Of course.
So this is really, really important for young women. So that's why when I had my child, I was missing that. I got melasma. I couldn't use it. But then I started to use more glycolic acid, which is allowed to have this bleaching effect, to have this peel effect. And as soon as I stop breastfeeding, zack, I need my retinol back.
You come back.
But these are the
because to me, retinoids is a bit like workout. It's like going to the gym. It hurts when you have not done it for very long, right? So you need to adapt. But if you keep that rhythm, and if you feed your skin, as you say, the antioxidants, barrier, right? So ceramides, hydration, sun protection, all those good things, niacinamide. So I think we more or less covered. I think you convinced me about the Hollywood peel. I don't know if it's because
it's really cool treatment. Yes,
I'm
it's
such
also
a superficial
it's not so comfortable. It's a bit painful, and it's a bit loud, because this carbon mask is really, when it explodes, it's like. But
but I like that. It sounds a bit like science fiction special effects.
Yeah,
like
but you will enjoy afterwards your smooth skin. It's really cool.
Okay, so maybe I'll visit you. You know, I'm such a superficial soul. Hollywood Peel already sells it to me just because it sounds like a bit of a glamorous facial. And,
Yeah, but the name is because you can go on the red carpet right away, you know, and it's
okay.
And it's of course everything is a bit from the US, so the name comes from that. But it means as well that you have no downtime. You can go out. You look great immediately.
Okay, sounds like a good addiction to my Swissline very skin-friendly skincare and the sun protection, which I just saw someone also commenting. Now it's one for me, saying that I look young enough, so maybe I'm the vampire. Well, you know who did that? It was my son that was there because I saw his name. So
okay.
So Dr. Meli, I think this was lovely. I hope everybody enjoyed that we kind of answered some of the doubts. And maybe we're going to do another one like this to go deeper into one or another next time.
Of course, of course.
Is this official? We have an invitation
I'm
open?
I'm always in. No
Pleasure.
problem.
Thank you so much for your time.
It's really cool.
Thank you very much for your time.
Yeah,
I hope you enjoyed as well. And we see each other soon, maybe for that Hollywood Peel. Ciao, guys. Ciao, everybody. Take care. Thank you, Dr. Meli. Thank you.